Hey guys, I just wanted to give a big shout out to Anchor. Now that it's my second year of podcasting, I thought you all should know that I've only used Anchor to record all of my podcasts. And if you haven't heard about Anchor, it's simply the easiest way to make a podcast. Let me explain. It's free. There are so many creative creation tools that allow you to record and edit your podcast right from your own cell phone and your own computer. Anchor then does the hardest part for you. They go ahead and distribute your podcast so it can be heard on Spotify, Apple Podcasts, and so many other platforms. Now, I think it's everything you need to make your own podcast in one place. So what are you guys waiting for? Go ahead and download the free Anchor app today and head on over to anchor.fm to get started. Have fun. Hey everyone, welcome back to all my listeners. Now I hope you're all having a great day so far. I know I am. Now I can't believe it's already the last week of January, and I'm happy the month took its time to roll out. I'm happy for the slower pace, at least it feels like a slower pace, to 2022 so far. And if it's your first time finding me, thanks so much and welcome. Welcome to episode 4 of my 5th season. Today is Wednesday, January 26th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, guys, I've got a lot to get into today. So I'm going to be diving into my compliance tip today with the first CBR, or Comparative Billing Report, of the new year. And it's on Chiropractic Manipulative Treatment Services of the Spine. And hey, it's my very favorite month-end episode where I discuss highlights from the month of January's criminal and civil enforcement cases involving fraud, waste, and abuse. And I go ahead and round out today's episode with a remarkable quote on clarity and focus from Deepak Chopra. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. You're really helping to support my podcast every time you do that. And I really appreciate all your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into Newsworthy, the month's fraud, waste, and abuse cases. The month of January saw 18 cases as of the recording of this episode. Early January saw an Ohio home health care provider who agreed to pay $500,000 and close its operations as part of a False Claims Act settlement. Now, this home healthcare agency, this HHA, provided services to patients in Ohio, many of whom are disabled and living in group homes. Now, the settlement details that the healthcare provider's billing practices allegedly routinely caused Ohio Medicaid to pay at a higher level of reimbursement than warranted by the services provided, as well as the setting in which the services were provided. Now, from the years 2014 until 2017, the HHA billed for individual healthcare services when, in fact, any of the services actually rendered were in group settings. Furthermore, the HHA's nurses did not spend the time required with patients to receive the reimbursement they did for individual services. Let's move on. Early January also saw yet another HHA case that settled for $630,000 in settlement with a Massachusetts home health care agency and its owners, and they resolved allegations that they billed the state's Medicaid program, known as Mass Health, for services that had not been appropriately authorized by a physician. Now, according to the Massachusetts Attorney General's office, the owners failed to ensure that the claims they submitted to Mass Health complied with the plan of care requirements certifying the services as being medically necessary. The owners also allegedly knew that they had received overpayments from the state as a result of their submission of claims, but they made no attempt, allegedly, to notify or return any overpayments to Mass Health. Now, this investigation began with the Attorney General's office following a referral which was made by Mass Health. To bill Mass Health for home services, the member's physician must review and sign a plan of care. Home health agencies are required to maintain updated medical records of medically necessary services provided to each member for at least 6 years after the date they were first administered. Now, ironically, these same owners owned another home health care agency that agreed to pay $3.1 million back in 2020 to settle similar allegations of falsely billing Mass Health. Now, let's move on. Again, early January saw some more fraud, and in my opinion, a disturbing case, which involved a North Carolina physician who was indicted for adulterating medical devices for reuse on patients and fabricating records and much more. Now, according to the indictment details, between the years of 2014 through 2018, this physician billed Medicare more than $46 million for allegedly rendering more than 1,200 incidents of balloon sinuplasty services to more than 700 patients. Now, her practice received more than $5.4 million for these balloon sinuplasty services. And during portions of this same time period, again from 2014 through 2018, she was the top paid provider of balloon sinuplasty services in the United States, despite the location of her practice being outside of a major metropolitan area. Now, she profited substantially from these billings to the Medicare program. Now, in my opinion, again, this is in my opinion, I think what's disturbing here is that these medical devices are for single use only. And according to the indictment details, she, quote, reused balloon sinuplasty devices on her patients, even though the devices were marketed and sold to her for further consumption by her patients as sterile, single-use devices. The devices specified herein, which routinely contacted blood, phlegm, pus, and mucus secretions when inserted into the sinuses, were not approved or cleared by the United States Food and Drug Administration, that's our FDA, to be reprocessed or reused. She was fully informed that the devices were strictly single-use devices and that the devices were not intended to be reprocessed or sterilized, end quote. Now, let's move on. Mid-January saw a diabetic shoe company and its owner agreeing to pay $5.5 million to resolve False Claims Act allegations regarding custom shoe inserts. Now, this will settle allegations that the company sold custom diabetic shoe inserts that were not actually custom fabricated in accordance with Medicare standards. The agreement is part of a civil settlement that resolves claims brought under the False Claims Act. The United States alleged that between the years 2013 through 2018, this Florida company sold diabetic shoe inserts to its customers nationwide and represented that many of those inserts were custom made for an individual's foot, when the inserts were actually, in fact, made using generic foot models. So again, there was no individuality there. The inserts were dispensed to diabetic patients who had a prescription from a healthcare provider and who believed they were getting a custom product. And according to the government, despite fabricating the inserts using generic models, the company billed Medicare and Medicaid for the custom version or sold the inserts to other providers who then billed the government healthcare programs for custom inserts. Now, this alleged conduct allowed the company in Florida to produce and sell even more inserts and increase their profits by cutting corners. The government also alleged that this Florida company advertised to customers that it was proud to be Medicare compliant and had received Medicare approval for its custom diabetic shoe inserts, even though the company received the Medicare approvals based on false information. Now, in connection with this civil settlement, the company and owner entered into a 3-year integrity agreement, or IA, with the United States Department of Health and Human Services and the Office of Inspector General. That's our HHS OIG. Now, this integrity agreement, this IA, requires, among other things, that the company implement updated policies and procedures as part of its compliance program and hire an independent review organization, an IRO, to review quarterly the company's claims to Medicare and Medicaid. Now, let's move on. Mid-January also saw a new unit formed to combat healthcare fraud in West Virginia. Now, state and federal agencies held the first meeting of the Mountaineer Healthcare Fraud Strike Force, which is the new unit that will take a data-driven approach to uncovering waste and abuse. Now, representatives from 7 different agencies discussed fraudulent billing patterns and new targets that were identified as a result. Now, there's a new hotline, there's a new email address, and there's a new mailing address that have been established to allow for the reporting of potential fraud. Now, anyone with information may call a new hotline number and send an email and mail correspondences to the U.S. Attorney's Office in West Virginia. Now, in addition to this analytical work that the strike force will be conducting, they will also engage with providers and insurers so that there's a better understanding on how to recognize and report healthcare fraud. Now, of course, there were also many of the usual suspects, like more opioids distributors and more overprescribing, and of course, those kickbacks and bribery schemes and fraudulent DME billings, and of course, the never-ending money laundering. But I'd like to discuss 2 cases involving another COVID-19 scheme and more news yet again on P-STIM devices. Let's start with P-STIM. Now, in New Jersey, there are 6 medical practices and 1 physician owner who are to pay $7.4 million to resolve claims of improper billing of Medicare and the Federal Employees Health Benefit Program for acupuncture procedures. Now, the defendants here are with an interventional pain management center, and they allegedly treated patients with, of course, the notorious electroacupuncture devices called P-STIM and NeuroStim, or NSS. Now, P-STIM and NSS procedures transmit electrical pulses through needles placed just under the skin on a patient's ear. Both treatments are considered acupuncture under Medicare and the Federal Employees Health Benefit Program, the FEHBP, and those guidelines, and are therefore ineligible for reimbursement by the government. Now, from the years January of 2012 through April of 2017, the surgery centers and medical offices submitted claims to Medicare and the FEHBP for P-STIM and NSS treatment and associated administration of anesthesia. Now, in submitting these claims, the defendants allegedly used a billing code that mischaracterized the acupuncture treatment as a surgical implantation of a neurostimulator. In addition to paying the settlement, the owner and these entities have agreed to enter into an integrity agreement with the HHS OIG. Now, the integrity agreement requires that these entities and their owners implement specific measures intended to prevent future healthcare fraud and address evolving compliance risks. Now, these measures include training for staff on applicable healthcare fraud laws and submitting to claims review conducted by an independent review organization, an IRO, to ensure compliance with Medicare billing requirements. Now, let's move on to that COVID-19 scheme. Now, here, there's a lab owner in Florida who pled guilty to an alleged $6.9 million genetic testing and COVID-19 testing fraud scheme. Now, this alleged conspiracy to defraud Medicare involved paying kickbacks and bribes to obtain doctors' orders for medically unnecessary lab tests that were then billed to Medicare. Now, this lab owner exploited the COVID-19 pandemic by bundling COVID-19 testing with other forms of testing that patients did not need, including genetic testing and tests for rare respiratory pathogens. And according to court documents, the owner allegedly admitted that he bribed patient brokers who would then refer more Medicare patients and doctors' orders authorizing medically unnecessary genetic testing to his laboratory. The owner and these patient brokers entered into sham agreements to disguise the true purpose of these payments. And once the COVID-19 pandemic began, he exploited even further patients' fears of COVID-19 by bundling COVID-19 tests with more expensive, medically unnecessary testing, including respiratory pathogen panel testing, and at times, specific genetic testing for cardiovascular diseases, cancer, diabetes, obesity, Parkinson's disease, Alzheimer's disease, and dementia. Now, in total, he allegedly caused his laboratory to submit over $6.9 million in false and fraudulent claims to Medicare for these medically unnecessary tests. All right. My goodness. Wow, it's the new year, and the stories don't really change here. Stories don't really change. So the new year starts off with a bang and a boom, right? A bang and a boom in the world of fraud, waste, and abuse cases. Now, I've discussed PSTEM devices in so many previous episodes, and I can only continue hoping that we're getting closer to ending this type of erroneous coding and billing practice for non-covered, non-reimbursable electroacupuncture devices. But I'm also happy to see in this case, which went to an integrity agreement involving compliance. I'm always happy and glad to see providers wanting to start doing the right things for the sake of coding compliance. I do my very best each month trying to highlight those cases I find most interesting. I try my best to provide solid guidance and advice to my providers to be mindful of correct coding and compliant billing practices to avoid joining these very serious, these very public, and often very hefty outcomes. I always believe these types of fraud, waste, and abuse cases are most helpful. Please take a deeper look into these reports and see how they may affect you, your provider, your facility. Start self-auditing your service claims and coordinating documentation to ensure you are meeting compliance. And now it's time for my best practice tips in Trusty Tip. So, in today's compliance tip, I wanted to focus on the latest Comparative Billing Report, or CBR, issued on Chiropractic Manipulative Treatment, or CMT, of the spine. Now, this is CBR number 202201. That's right, it's the very first CBR for the new year, for 2022. Now, in late January, that's right now as I'm recording, or within the next couple of days, CMS will be issuing a comparative billing report, the CBR, on Medicare Part B claims for chiropractic spine treatment. Now, they're going to be reminding us to use this data-driven report to compare your own billing practices with those of your peers in your state, as well as across the nation. Now, the CPT codes here are going to be limited, right? So the first is CPT code 98940, which is defined as Chiropractic Manipulative Treatment, or CMT, spinal 1 to 2 regions. The second CPT code is 98941, which is defined as Chiropractic Manipulative Treatment, CMT, spinal 3 to 4 regions. And finally, the third CPT code involved is 98942, Chiropractic Manipulative Treatment, CMT, spinal 5 regions. Now, this CBR 202201 analyzes the following things. There are two of them. The first is the referring and rendering providers identified with specialty number 35 for chiropractic that submitted claims to Medicare Part B for these CMT services of the spine. And secondly, the analysis will include the submission of claims by those providers for these particular CPT codes for the CMT services of the spine, which again include 98940, 98941, and 98942. Now, the overarching rationale behind your receiving this CBR 202201 is that first, the CBR will be summarizing the statistics for the services with dates of service from January 1st of 2019 through December 31st of 2019. So that's one full year that will be in summary for these particular CMT services. And second, they're going to provide you with a large number of rendering providers. So during that year, from January 1st, 2019 through December 31st of 2019, there were a total of 42,813 rendering providers with combined allowed charges of over $768 million for providers that submitted claims for CMT services of the spine. Now let's hone in even further. The criteria for receiving this particular CBR 202201 involves that a provider is, number one, significantly higher compared to either state or national percentages in any of the three metric calculations. So you have to be greater than or equal to the 95th percentile to receive it. And second, if you have at least 60 beneficiaries or Medicare patients with claims submitted for CMT services of the spine. And finally, third, if that provider has had at least $20,000 in total charges for CMT services of the spine. Now, the metrics for CBR 202201. So this report provides the following metrics. The first metric is the average allowed services per beneficiary. Now, the calculation of metric number one is that the number of allowed services for CMT services of the spine is divided by the number of unique patients who received CMT services of the spine. Now, the second metric involves the percentage of CMT spinal services billed with CPT code 98942. So that's a particular metric that's calculated by the total number of allowed services for CPT code 98942, and it's going to be then divided by the total number of allowed services for all CMT services of the spine. And then finally, the third metric involves the percentage of claims billed with modifier AT. Now, this third metric is calculated by the total number of unique claims for, again, those CMT services of the spine billed with modifier AT, and that's then divided by the total number of unique claims for all CMT services of the spine. Now, it's critical to understand that a CBR does not indicate that you're going to be getting an official audit. Although please, and I've said this in earlier seasons when I discussed the CBRs, please be mindful that this phrase is coming directly from the MACs that issue the CBRs. So remember to take that with plenty and plenty of grains of salt. More directly, consider this to be your notice, your warning that you are being looked at closely. But let's remember there is value to the CBR that the providers get, right? It should be serving as a tool to look at your billing patterns as compared to your peers. The value also includes the facts that specific coding guidelines and billing information will be detailed throughout the report. The CBR informs providers whose billing patterns differ from those of their peers. Now, the desired behavior here is to capture proper and compliant documentation for CMT spinal services, right? So in this instance, I hope providers are performing their internal auditing. It's fundamental if you have Medicare as a payer to keep your eye on correct and compliant coding and billing practices and make sure you're adhering to them, to all of them. It's vital to capture full and robust documentation to ensure you are meeting the medical necessity from the very start. So please start tracking your CMT services. Are you paying attention to the active treatment modifiers, those AT modifiers? Are you documenting the levels of the spine that you're manipulating, from cervical to thoracic to lumbar to sacral to pelvic? Are you describing the subluxation of the spine details for each spinal level being manipulated? So, a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, I focus Season 5 Spark on clarity and focus. I want this 5th season Spark to be filled with the world's thought leaders, writers, artists, philosophers, everyone who inspires the need for clarity and focus in all we do. So, in this week's inspiring quote, in Spark, is from Indian-born American author and alternative medicine advocate Deepak Chopra. Insight enables you to know your own heart. Clarity enables you to accept without illusion. Absolutely true, right? I think the new year always inspires us to start fresh, to start with a clean slate, full of insights to gain and clarity to seek. I think this quote reminds us that illusion will never stand in our way when we have gleaned true insights and found the clarity needed to accept our greater focus and greater purpose. I'm happy Deepak Chopra's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please have an amazing week ahead, and please continue staying safe and healthy. Thank you so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.